Welcome to video series on lipid metabolism. This video is on metabolism of ketone bodies. Now, why is this topic important? Now, this is important from your exam point of view, wherein this is the probable question that is asked. Name the ketone bodies. How are they synthesized in a body? Describe utilization of ketone bodies, and associate clinical significance can also be asked as a case-based question. From patient point of view, you need to know the difference between diabetic ketoacidosis, starvation ketoacidosis, what is ketonemia, ketonuria. Let's try to understand all of this in this video. Now coming to what is ketogenesis and what is ketolysis. Now this ketone bodies, you need to remember there are two types. Okay, so the primary ketone body and the secondary ketone bodies. Primary ketone body is acetoacetate, and acetone and beta hydroxybutyrate are secondary ketone bodies. So the normal levels of ketone bodies in a healthy individual is always less than 1 milligram per deciliter. Now this ketogenesis, synthesis of ketone bodies, mainly occurs in liver, and especially the cell organ involved is mitochondria. And ketolysis mainly occurs in peripheral tissues and does not occur in liver. So this usually is asked as a MCQ based question. So peripheral tissues, in all the peripheral tissues, ketolysis occurs except in liver due to the absence of the enzyme. So coming to the pathway of ketogenesis, this starts with condensation of two molecules of acetyl-CoA to form acetoacetyl-CoA with the help of the enzyme acetoacetyl-CoA synthase. In the next step, acetoacetyl-CoA further condenses with one more molecule of acetyl-CoA catalyzed by the enzyme HMG-CoA synthase to form beta-hydroxy beta-methyl glutaryl-CoA. This undergoes lyase reaction with the help of HMG-CoA lyase to form acetoacetate. Now, so acetoacetate is a primary ketone body. This is the first ketone body formed from lyase reaction of HMG-CoA. Now, this acetoacetate can undergo spontaneous non-enzymatic decarboxylation to form acetone, and it can undergo reduction to form butyrate. Okay, and the reducing agent is N. So coming to the pathway of ketolysis, now first the ketone body has to undergo activation. So as acetoacetate is a primary ketone body, now this undergoes activation with the help of succinyl-CoA, and the enzyme is thiophorase. This results in the formation of acetoacetyl-CoA and succinate. Now this is activated acetoacetyl-CoA is lysed by lyase enzyme to two molecules of acetyl-CoA. This will enter into TCA cycle where it gets completely oxidized, liberating energy. That is how the ketone bodies undergo lytic reaction to provide energy to the peripheral tissues. Now all the peripheral tissue has got the thiophorase enzyme. That is why ketone bodies are utilized by all the peripheral tissues except liver. Liver lacks this enzyme, so ketolysis does not occur in liver. That's a point you need to remember. Okay, coming to regulation of ketogenesis and ketolysis, there are three levels of regulation. So the level 1 is at adipose tissue. Now this adipose tissue is the organ where the triglyceride is stored. Now here lipolysis occurs whenever we are fasting and starving, releasing free fatty acids. So level 2 is at the level of hepatocytes of liver. So here activation of fatty acids occurs by carnitine acyltransferase 1, which will push the fatty acids to undergo beta oxidation in the mitochondria of the hepatocytes, ending with formation of acetyl-CoA. So the level 3 regulation is further oxidation of this acetyl-CoA in TCA cycle to provide energy. So in conditions where there occurs high glucagon and low insulin ratio, there occurs this ketogenesis, ketonuria and ketonemia. So this high glucagon and low insulin ratio is ketogenic. Now this is one of the MCQ that will be asked, this ratio. So always remember it is the high glucagon and low insulin ratio is ketogenic. So what level of regulation is disturbed when there is high glucagon? Let us try to understand. So level 1, there is no problem. Adipose tissue undergoes lipolysis under the influence of glucagon during fasting or starvation, releasing free fatty acid. Level 2 also, liver, there is activation of fatty acid by carnitine acyltransferase, undergoes beta oxidation to form acetyl-CoA. Now level 3, in healthy individuals, what happens is, that is when the ratio is maintained appropriately. So this acetyl-CoA is channelized to electron transport chain to provide energy, right? So this gets diverted in high glucagon ratio because because high glucagon favors gluconeogenesis. Okay, so there is increased gluconeogenesis because of decreased oxaloacetate. As you all know, oxaloacetate acts as a catalyst in TCA cycle. So there occurs increased generation of acetyl-CoA but decreased oxidation of acetyl-CoA in TCA cycle. So now this acetyl-CoA gets diverted to ketogenesis, and this results in accumulation of the ketone body in the blood circulation known as ketonemia or ketosis. So when it exceeds the capacity of the circulation to hold the ketone bodies, it gets excreted in urine, which is known as ketonuria. So this is about the regulation and its clinical significance when there is high glucagon, low insulin. Okay, coming to the applied part. So this ketonemia, ketonuria occurs in diabetes. Now diabetic individuals diabetes is a state characterized by hyperglycemia. So excess glucose, if the patient is not exercising and is not compliant with the anti-diabetic drugs, so what happens is excess glucose gets converted to initially under aerobic condition gets converted to pyruvate, and pyruvate gets converted to acetyl-CoA. So now this acetyl-CoA has to enter TCA cycle. So this acetyl-CoA will enter TCA cycle only when the patient is utilizing the energy. So when patient is leading a very sedentary life, this acetyl-CoA gets diverted to form ketone bodies. Okay, this usually occurs as a complication of diabetes known as diabetic ketoacidosis. So the next condition where we get to see increased ketone body formation is starvation. So when we are fasting, so what happens? We are not taking anything orally. So when we are not consuming any carbohydrate, there is no glucose. So body is left with breakdown of the lipids in the form of fatty acids. So there is increased breakdown of fatty acids. So fatty acids undergo oxidation by variety of pathways. The mainly predominant pathways beta oxidation, which will end up with formation of increased acetyl-CoA. Now again this acetyl-CoA cannot enter TCA cycle because of deficiency of oxaloacetate, as the person is not taking anything orally. So this acetyl-CoA results in the gets converted to ketone bodies. So that is why. So this condition is known as starvation ketoacidosis, and when it occurs in a diabetic individual, it is known as diabetic ketoacidosis. So the other condition where ketone bodies are increased is hyperemesis of pregnancy. Hyperemesis is a state where there is increased vomiting experienced by the pregnant lady. So when everything is lost, so the pregnant lady needs continuous source of energy to sustain well growth of the growing fetus. So fatty acids are broken down, increased formation of acetyl-CoA, and it exceeds the capacity of the acetyl-CoA to enter into TCA cycle. Excess of acetyl-CoA get converted to ketone bodies. That is why so ketonemia and ketosis is also common among severe vomiting of pregnancy. Next, now all these are the three conditions you need to remember. Okay, there are so many other conditions, but at undergraduate first year level, if you remember these three, they are more than sufficient. Okay, now these ketone bodies are acidic in nature. This is because, just let us try to enumerate the ketone bodies. We have acetoacetate, beta hydroxybutyrate. They are all acidic in nature. So when they accumulate in the general circulation, as I already told, the normal level should be less than 1 milligram per deciliter. So when there is accumulation of ketone bodies in the general circulation, it results in a condition called metabolic acidosis. Now these ketone bodies are excreted in urine because the circulation cannot hold the ketone bodies for a very long time. So they get excreted in urine, and this condition is known as ketonuria. So whenever they are getting excreted, there occurs loss of sodium and potassium along with ketone bodies, resulting in the formation of hyponatremia and hypokalemia. So more water is also used for excretion of ketone bodies, and patient can develop dehydration. Okay. So how are these ketone bodies detected? So these are detected with the help of Rotheras test. Okay. So which will mainly detect acetoacetate and acetone, but this does not detect beta hydroxybutyrate. Okay. Now this significance of this test in diabetic ketoacidosis and starvation ketoacidosis you need to know, and this has got great biomedical importance also. In diabetic ketoacidosis, there is increased glucose and increased ketone bodies. So both Benedict's test and Rotheras test will be positive. Whereas in starvation ketoacidosis, because patient is not taking any thing orally, so Benedict's test will be negative, Rotheras test will be positive. So this point biochemical test you always you need to. Okay, just to summarize this ketogenesis and ketolysis using a flow chart. Now this ketogenesis is mainly taking place in the mitochondria of the hepatocytes. So as you already know, two molecules of acetyl-CoA condense to form acetoacetyl-CoA. This undergoes further condensation with one more molecule of acetyl-CoA to form HMG-CoA. This is lysed to form acetoacetate, which undergoes spontaneous non-enzymatic decarboxylation to form acetone and reduction to form beta hydroxybutyrate. Now these ketone bodies are released into general circulation, and their concentration in healthy individuals is always less than 1 milligram per deciliter. So among the peripheral tissue, heart and kidney prefer ketone bodies as primary source of energy. Even though when glucose is available, they prefer ketone bodies, which they oxidize the ketone bodies and utilize that energy for their metabolic functions. Okay, so whereas this brain and skeletal muscle utilize ketone bodies as secondary source of energy. So they usually prefer glucose as source of energy, and when glucose is not available in conditions of fasting and starving, brain and skeletal muscle utilizes ketone bodies as secondary source of energy. One more point I stress, which you need to remember, is ketogenesis occurs in liver, whereas ketolysis occurs in all the peripheral tissues except in liver because of deficiency of thiophorate. Okay, so that was all about metabolism of ketone bodies. Coming to the assessment part, ketone bodies are synthesized in simple straightforward question: liver and the cell organ involved mitochondria. Major ketone bodies include all except pyruvate body. Rate limiting enzyme of ketogenesis is HMG-CoA synthase. HMG-CoA reductase is a rate limiting enzyme of cholesterol biosynthesis. Okay, whereas HMG-CoA synthase is a rate limiting enzyme of ketogenesis. So slightly confusing. So you should read the option properly when it is and read the stem of the MCQ also, and the keys also of keys of the MCQ. Ketone bodies are formed from acetyl-CoA, which is the ketone body. Ketogenesis is increased in mainly in starvation, so it does not occur in well-fed state, and under the influence of insulin, ketogenesis not occur. So it mainly occurs in starvation. Organ that utilize ketone bodies is that cannot utilize ketone bodies is liver, because it lacks thiophorase enzyme. Major circulating ketone body is beta hydroxybutyrate. So the common mistake students does is they usually answer acetoacetate. Acetoacetate is only the primary ketone body, but the circulating ketone body is beta hydroxybutyrate. Ketone bodies are utilized in brain. Okay, so brain utilizes ketone bodies during prolonged fasting, and mainly utilizes it as secondary source of energy when glucose is not available. Okay, RBCs cannot utilize ketone bodies because they lack mitochondria, and as you all know, ketogenesis mainly occurs in mitochondrial sites. Okay, fruity odor and diabetic ketoacidosis is due to acetone, which gets excreted through the breath of the patient, imparting fruity odor. Excess ketone bodies lead to acidosis because the nature of ketone bodies is that is the acetoacetic acid and beta hydroxybutyric acid, they are acidic. Okay, ketone bodies are water soluble because is the answer. They circulate in blood. Ketogenesis is stimulated by glucagon. High glucagon, low insulin ratio is always ketogenic. You need to, okay. Beta hydroxybutyrate is formed from acetoacetate by reduction. Which condition causes excessive ketone body production? It is both in starvation also and in diabetic mellitus, uncontrolled diabetes mellitus, or patient when they are not taking anti-diabetic drug properly, they tend to develop diabetic ketosis. Okay, ketone bodies provide energy mainly during fasting, starvation. Ketone bodies pair with substrate in starvation. Usually proteins are spared because brain adapts to ketone bodies and reduces breakdown. So that was all about metabolism of ketone bodies. Check out for the MCQ score. If the score is less, rewatch this video and resolve all the MCQs. So if you like the video, please do like, share and subscribe. So the next video will be on lipoprotein metabolism. Thank you for watching. Happy learning.